Welcome, welcome, welcome to Health Issues. I'm your host, Sylvain, and I am so thoroughly excited about today. I'm Xavier University graduate and love it. But we have an awesome guest for you today, and it's Dr. Kristi Rapp from
Xavier University College of Pharmacy.
Xavier University College of Pharmacy. But from what city?
Originally Macomb, Mississippi.
Macomb, Mississippi.
Yes.
Excited, and went to Xavier and traveled all the way down.
Yes.
Excited about that. But she is the chair of the Division of Clinical and Administrative Sciences at Xavier University.
Yes.
College of Pharmacy. And we're here to talk to you about health disparities. Welcome, Dr. Rapp.
Thank you.
We're excited to have you. We really, really are. So we're talking about, and if those who saw the show last week, there's a conference that's coming up February 29th at the Sheraton, and just Google Xavier University Health Disparities Conference, and you can get all of the information. We like, as many people, activists and scientists, health professionals, really want to be a part, and it's an exciting thing. We're excited about what Dr. Kennedy is doing and the whole team. But today we're talking about health disparities itself. And particularly the role of pharmacy in health disparities. So give us some background about this concept of health disparities and how pharmacy can help.
Okay, well, health disparities is when there's a difference in disease burden among different groups of people. So it could be by race, it could be by age, gender, but there are differences that exist among these diseases, for example. And that is what we term a health disparity.
Interesting, because I'd always thought that it was about black folk. But it's not. A disparity is just a disparity. It could be, women can have a health disparity.
Yes.
Got it, got it. Or in any way, shape, or form, young people can have health disparities. More than likely, though, much of the work has been focused on, I guess, the major health disparities in dealing with income.
Yeah, so certainly by income as well. And there are numerous health disparities that exist in this country. And we could look at it by race, because there are significant disparities that exist for that African American population, that, such as asthma. That is a huge one. That exists. So, but also when you look at socioeconomic issues, or when we look at those determinants, they exist there as well.
Do we know yet, and I'm just throwing this out, we hadn't talked about it, do we know yet if we tease out income, would we still have disparities?
I would say yes. And I have not done a thorough literature review on this, but there are disparities that exist that may not be related to income. It could be such as gender. It may be related to the gender. This affects women more than men. It affects children more than adults. So those type of things could exist without it being
without it being income. And I guess and even still, because we know we always talk about ACT scores and different things like that. We have variances at equal income levels. $100,000 African Americans may still have disparities with other races, even at high income levels. But there's more to talk about during the day. We can throw more of that out.
Well, I'll say this. Just recently I was reading a study when you talk about income, and the study, of course, was on asthma. That's my area of interest. But it looked at patients that had the same insurance company.
Wow.
They had the same insurance, so the payment was not an issue. So that's what I'm saying. It took away the economic part of it. But what they did notice, there was a race issue or a difference with how the patients were treated. So they had the same income level, the same insurance, medication was not a problem, but there was a disparity that existed with these patients. So it's not necessarily income dependent, but there are many disparities that, income plays a huge role.
Now let's talk about pharmacy, though, because see, who sees patients more than a pharmacist? Literally nobody.
No.
We see them every day, not every day, but literally, up to 2 and 3 times a week, and continually for patients and asthmatics that are on 2 and 3 and 4 different medications. That relationship, could pharmacy be the profession that can most take us to health equity?
Well, I'll say this, pharmacists can play a huge and enormous role in improving this health disparities, the health disparities that we have. Pharmacists, as you say, we come in contact with patients probably more than any other healthcare professional that exists. Right. So the patients are seeing their pharmacist day to day, every week, every month, whereas they may not see their primary care provider once a year, every 6 months. And so to me, that patient-pharmacist relationship is like the foundation. It is very important. And pharmacists can play an enormous role in making strides towards that health equity that you talk about.
But you have this big gap between what the pharmacist knows and what the patient knows. Patients, I mean, they can't even pronounce the drug. So how can they even understand? They are dependent upon that pharmacist, would you say?
Well, I would say it starts with training. Okay. So I'll start there. At least at my institution, the health disparities concept is embedded into the curriculum. So we're exposing our students on what is a health disparity. We expose them when they go on rotations because they are rotating through sites that are serving these underserved communities. So they're getting first-hand experience on this. They're getting training from preceptors who deal with this issue and deal with this concept often. And so by the time they make it to practice, I feel very confident that our students will be able to communicate appropriately with any type of patient. And get this much needed information and bring it to a level that any patient can understand in order to improve health outcomes.
I like that, because your job at Xavier is to ensure just what you said, that those students, the pharmacy school in and of itself, that are when they walk out the door, that they're prepared to interact with that patient and know what's going on, offer value, and improve their health.
And in fact, one of the mission of the College of Pharmacy is to prepare students to impact medically underserved areas. So again, it's embedded in the curriculum, and I feel that we recognize that this is an issue. And as you stated earlier, pharmacists can play an enormous role in making strides towards decreasing that gap in health disparities.
So interesting. Xavier's a forerunner in this conference on health disparities, but the answer is within the walls.
Yeah, I mean, the solutions, we know the problem exists. So there's a problem. It's been here for years. Health disparities is real, and they have been around for, as long as I can remember, this has existed. So, instead of identifying the problems, we do need to look more towards solutions. And, there have been strides in basic science research. There have been strides in, looking at the primary care physician. There have been strides in what can nurses do. But ultimately, again, I'm such a proponent of pharmacy, and the impact that a pharmacist can have is just so great. And I wish, that those doing studies and those perhaps granting or giving funding or extending funding can realize that this could be a true impact and really have positive health outcomes if pharmacy, if the focus has been on pharmacy and what we can do for these patients. We need more solutions, and I think it's about time that we think outside of the box, and pharmacy is one of those things.
In other words, we have this massive power source, a solution just bouncing around all of the communities all over. We just need to make the proper connections, because who's more valuable and has a better level of understanding and already embedded into communities?
Yes.
You have pharmacists on every corner.
Yes.
Literally. Pharmacists in barrooms.
everywhere. Pharmacists are everywhere, and most patients come in contact with the pharmacist.
That's right.
And it's just an opportunity that exists to help close this gap.
And you said outside the box, because let's talk about the box though. There are a lot of, between insurance companies, regulatory agencies, the bank, profit, you know what I mean, profit corporations, corporate structures, traditional ways of operating, competition from other professionals where not competition or cooperation or whatever it is, pharmacy has found itself being more narrowed and disempowered over the years. Your thoughts on that?
Well, I think with some of the hardships, I would say that pharmacy has experienced over the years, it's very important that we continue to make strides towards the profession and increasing recognition and increasing our visibility on what we can do. Right. The services that pharmacists can offer, the impact, truly the impact that a pharmacist can have on patient health and health outcomes, improving the blood pressure, decreasing the cholesterol, decreasing the blood sugars, is there. It's in there. We know that pharmacists can do this and we can do it well, okay? So now it's more about, in my mind, we know this, how do we increase the visibility and let others know so we can collaborate with groups to think about pharmacy as you're trying to close your health disparity. Perhaps we're the component that you need to truly make it a successful venture, for that. So again, pharmacists can play a huge role. We know the data that's out there that exists. We know we can improve health outcomes, and it's time again to think out of the box and really just show it and move into action that we can do these things.
Hey, I'm sold now. Okay, let's look at it on the flip side.
Okay.
Okay, the groups are saying, well, since I don't see value, I don't see the visibility of the value, I'll just ship them the drug mail order. And if they want to call, they can. And these drugs that come in like candy machines or whatever just pop right on out. Where all the payment structures and everything else like that is shifting away from the value of that particular pharmacist. When in fact, is anybody else in the community like a pharmacist there? So we're literally the systems are exacerbating the health disparities.
That's a very good, concept. I mean, I would say that the pharmacist has a valuable role in the process. Who better than the pharmacist to educate everyone on about the drug? So when you remove the pharmacist from that, then the negative health outcomes are more likely to occur when it comes to medication, because you've removed the drug expert from the equation. So again, the pharmacist can play a huge role there, and we really need to be present in order to assist in improving patient health.
Let's look at it. Let's throw another barrier in as we look at it, and we're going to flip it around, but another barrier. Access to information, we're just talking about medication. We're not talking about foods. We're not even talking about lifestyle, exercise, and all the other areas that pharmacists can and will do play a part. But in medications, many times throughout the medical system, if a patient's seeing 5 different doctors, which one of those doctors knows what the other doctor's prescribing? And the information that's coming to the pharmacist, is there a connectivity between the information where anybody knows exactly what all those doctors should be prescribing in this system?
And you have hit, one of the major issues. There is none exists right now where the pharmacist is electronically talking to that physician A, B, C, and D. There's not one system that everyone utilizes which would truly streamline therapy, and it would streamline management. It would cut down on the polypharmacy that we have, patients taking a medication for a side effect of another medication, physicians not knowing that the patient is on drug A, B, and C, prescribes D, which has a major drug interaction. So, it would be wonderful if the pharmacist could communicate with that primary care health provider with labs, with medications, with all of the information that is very important when you're managing a patient's disease state. I think it would cut down tremendously the amount of drug-related problems that we have and that patients experience daily.
Well, very interesting, because the United States spends more per capita than any other country, just about, at least highest amount, and have the least amount of outcomes. And we already know adverse drug effects, and let alone all the other areas. We literally may be sitting on one of the #1 reasons why adverse outcomes are so prevalent within the United States.
The pharmacist, again, and I can't stress this enough, valuable member of a healthcare team, a valuable member of managing a patient's disorder, disease state. Because yes, as much money as we spend in adverse drug effects,
right,
just on the drug
right,
itself,
right,
when we have an expert there that could mitigate a lot of the problems that a patient goes on to experience. So things like medication reconciliations, for example.
Right.
Okay? A medication reconciliation is when someone sits and goes through every drug, and they're looking for adverse drug events. They're looking for, is it efficacious? Does it work? Do they need to change? Does something need to be dropped? Does something need to be added? But is the patient even on this? Really getting a good sense of what is the patient on, okay? That person holds valuable information. Whomever does that is like building the foundation of the management and the future management of this patient. So we always need to know accurately what the patient is on at this time. It's called a medication reconciliation. Pharmacists can play a very huge role in that, and that's one thing, but it's so important. It's right, so important, right, that for someone knows accurately what the patient is taking. And if we all could talk, that's right, if the pharmacist could talk with physician A, physician B, physician C, and everyone is aware of what the patient is actually on, again, I think we're already improving health outcomes just in that one step.
Hey, it's simple if they're one physician, but hey, by the time they're over 65, they have 4 or 5 different doctors at various centers, mm-hmm, and it gets unreal. But the curriculum is specifically designed to do that. Course after course after course. The pharmacy student, mm-hmm, is being prepared over and over again to dig as deep as possible. Yes,
it's again embedded throughout, not only exposing students to what is a health disparity, what can pharmacists do, the role pharmacists play, cultural competency comes into play, but this med rec, on rotations as they go out, mm-hmm, many times, or most times, students are sitting with their preceptor and performing these medication reconciliations. They're trained to do this, and that's every time for a year. They're out on rotations, being trained in this way, so they can contribute to the improvement of patients' health. So we're training them to have a major role in improving patient outcomes and eliminating healthcare disparities. And so when they do get out there, it is my hope that they're being utilized to that utmost capacity where they can have that huge role in improving patient outcomes.
Well, let's start this out, because you spoke about this study earlier. Health disparities in cultural competency, almost like red beans and rice. Mm. In other words, you can't affect health disparities unless there's some level of cultural competency when you're speaking about racial health disparities. Mm-hmm. My thoughts.
Yes, and I'm going to go say education and counseling, mm-hmm, for a patient. Mm-hmm. So again, embedded in our curriculum, But certainly a healthcare, a pharmacist as a healthcare provider should be trained in how to approach, or the best approach to patients that, don't look like them, raised in another place, in another area, and how do you get this information across in a very respectful way, in a way that will be receptive, and in a way that ultimately, I'm always talking about improving patient outcomes. Because at the end of the day, we want our patients to be healthy.
And health is actually, it's more than just absence of disease. Mm-hmm. Yeah, mental health.
Yeah, it's so many components in being healthy. So it's not just do you have a disease, but we want to focus on prevention, right? Which we've embedded in our curriculum. I mean, public health plays a huge role. Pharmacists, look, prevention, immunizations. There are so many things that we can do on the preventative side. Not just, we don't want the patient to get the disorder. So exactly. We don't want you to develop diabetes. Right. And we're going to do all we can. And we can educate you, and we can counsel you, and we can give you wonderful recommendations on what you could be doing before that develops on down the road. So I agree wholeheartedly with you that it's not absence of disease, but we're also looking at the whole patient and preventive measures as well.
Well, and then just throwing it out, because from a patient standpoint, Mrs. Jones, she's like, I like to eat what I like to eat. I want to drink what I like to drink. I want somebody to help me with my medicine. I don't know what they can do. All right. I'll go to the doctor, and I'm tired of going to those doctors because they keep giving me all of these drugs. But at the same time, the average Mrs. Jones in America, she's moving from a fluid pill to a fluid pressure to a diabetic pill to kidneys failing onto dialysis. We're seeing that just at swing, but it's our area.
Yes, so that's what we don't want to happen, right? So we, ideally, Mrs. Jones, we could catch Ms. Jones early. She's on a fluid pill, right? Mm-hmm. And we don't want that to develop. So I guess, what is the pharmacist's role in this transition? We know that, there are underserved areas. We know that there are not enough primary care providers. And again, pharmacists are there, and we have the training, we have the knowledge to help prevent that progression to diabetes for Mrs. Jones. Right. The issue, what happens is, though, does Ms. Jones understand, and does Ms. Jones know what valuable resource that she's talking to every week, right, that can truly have a life-changing conversation or a life-changing session with that patient? Does Mrs. Jones, and this is what I'm talking about, increasing visibility as well, understand that? Does the primary care, say, provider understand that, overloaded, overwhelmed with patients, understand that a pharmacist can help and assist with managing Mrs. Jones so that disease or that disorder, that fluid pill, doesn't get to be a fluid pressure pill, doesn't get to be a fluid pressure diabetes medication, doesn't get to be insulin, So again, pharmacists have the knowledge, pharmacists have the training, pharmacists are capable of doing this. And I think it's about time that, we increase this thought and what valuable services that pharmacists can provide and informing the community. Pharmacists are in the community. Patients feel very comfortable with their pharmacist. Yes. And many patients who have that very good relationship, that very good, wonderful pharmacist-patient relationship, they know. Yeah. They know That's what right. their pharmacist can do. Right. And so it's there, it's evident, it's proven. Okay.
Studies have backed it up.
And we know what pharmacists can do. So, it's time to expand. And yell out loud and make it known.
Make it known.
That we're here, we're able to help you, and we want to help.
Oh, and it saves the country money. It saves the state money.
It does.
Insurance companies should be excited.
They should be, because we can keep the costs down.
That's right.
If the patient goes through counseling sessions, if the patient, are having visits with their pharmacist on, say, their diabetes, okay, we can hopefully prevent that hospitalization. We can prevent that ER visit for asthma. We can prevent the congestive heart failure, multiple hospitalizations over and over again.
That's right.
With just meeting with your pharmacist. It's there. We know it can happen. It's there. And it's time again, it's like a yell out loud that we're here and we're ready to serve and work.
And I guess it's a critical area, because particularly in the state of Louisiana with a new governor that's really re-looking at healthcare costs, because healthcare costs are obviously tremendous. And with the presidential election, those challenges also, it sounds like a great time to let people know about pharmacists' ability to help holistically. To literally, pharmacists is not there to go deeply into exercise, but can help them understand the role that exercise can play in our lives. Pharmacists, we're not dietitians, but we definitely understand the mechanics and literally how nutrition and foods play in a patient's life to help them understand better health and better eating, to educate them, and definitely in cases of asthma and healthy breathing and so forth, triggers that can affect those things. Just throughout the entire prevention area, I think it's politically strong, and that's not the job of the university, but maybe it is.
Well, I'll say this. One thing that's pending when you talk about, Congress and government is, that, and one thing that's missing, I would say, for pharmacists, that provider status.
That's right.
And if we could be recognized as such, I think right there, if that happens, that's an open door to show the impact that we can have, how we can reduce healthcare costs, because we've shown it now.
That's right.
But if we can get that status, I think the patients are in a better place.
That's right.
Because there's no concern with, billing, and we're less concerned with those type of things. And the patient could then be offered or extended this visit with the pharmacist, who has more than 15 minutes, by the way, to see you. We have 30 or 45 minutes.
I think we have the right advocate right here, the one with the visibility. Work as hard as you can. Love a pharmacist, connect with the pharmacist, and watch your health improve. Thank you so much.